When you are young, nature works for you. Being healthy is easy, it just happens. But as you reach midlife, 30s, 40s, 50s, it's no longer a default. Great health becomes a conscious choice. Even though I'm a medical doctor, I still fell into the same trap many of us fall into. I was really healthy and energetic until one day I wasn't. I started gaining weight, felt tired all the time, couldn't sleep at night, started getting brain fog, and eventually started losing my memory. And memory especially was really important to me because I was working in one of the major hospitals in Denver, Colorado, in ICU and specialty floors. And being on top of my game all the time was essential. My office was covered with sticky notes. My cell phone was full of reminders, and if it wasn't on my schedule with a reminder, it just wasn't happening. I struggled, and it was scary. I started going from doctor after doctor, doing every test there was. And you know what they told me? There is nothing wrong with you, everything is normal. I was shocked. Normal. I didn't feel normal. I didn't even feel like myself anymore. I finally realized conventional medicine is acute care medicine. We have great tools to help you survive, but we have no tools to help you thrive. I started looking for alternative options. And the first thing I did was to study Chinese medicine for physicians at Harvard Medical School. But even after learning everything they had to teach me, it still didn't solve my problems or give me the answers I needed. Next, I went on to Ayurvedic medicine, studying with Deepak Chopra. And he's a great man, and I learned a lot. But even after absorbing everything he had to teach me, I still didn't feel like myself and still didn't have memory, couldn't sleep at night, and had no energy. Finally, I went to a conference about something called functional medicine. I never studied functional medicine. It's not taught in medical schools. But everything they said made so much sense to me. Does your gut work? Do you get toxins out of your body? Are your hormones optimal? Do you sleep well? How do you balance your stress? I started applying all I learned to myself in my own life, and I was amazed. In 3 short months, my extra weight fell off. I could sleep again. My energy was back, and finally, I could remember everything about my patient care. Strangely enough, that created the biggest problem of all. Because here I was, working in a major hospital, doing procedures, prescribing medications, acting as if it were the only way. But now I knew it simply wasn't true. Great health doesn't come in a prescription bottle. It probably isn't covered by your health insurance, and it's certainly not accepted by a conventional medicine school of thought. I had to decide. Do I continue doing something I no longer believe in? Or am I going to find a way to help my patients to feel well and live a life of vitality rather than just doing damage control? I left the hospital and found my functional medicine practice. We help busy professionals and entrepreneurs who need to function at their optimal levels. My youngest client is 19. My oldest is 80. What they have in common is that they're sick and tired of being sick and tired, and they're willing to do what it takes to be at the top of their game. If this is the first time you're hearing about functional medicine, then I know it might be too good to be true. But if you are ready for a different approach because you've tried it all or because you don't want to try it all, then I'm happy to guide you. In my 30 years of practice, I've seen time and time again, if you lose your health, nothing else matters. I believe we all deserve to live the best life, and the best life is only possible with the best health. Yeah.